It's my pleasure to introduce our first speaker today, John Morrison. John is one of the leaders who had the tenacity and the vision to create the positive change we are celebrating today. As the founder of the Healthy Montana Kids Initiative, John spearheaded the effort to make the dream of Healthy Montana Kids a reality. John has a long history of working on behalf of Montanans in both their long and short-term health and well-being. As you all know, he served as our state auditor from 2001 to 2008, and then led the creation of HMK, but also Insure Montana and the Montana Health Co-op. He chaired the Health Insurance Committee for the National Association of Insurance Commissioners and the Senior Health Insurance Oversight Trust. And as an attorney here in Helena with Morrison, Sherwood, Wilson, and Diola law firm, John continues to respond to the needs of Montanans by protecting their rights as consumers, as patients, as recipients of health care, and making sure that they're having their rights protected. So thank you, John, for all that you do, and I will hand it over to you.
Welcome, everyone, and thank you for joining us for the 10-year anniversary celebration of Healthy Montana Kids. Until 2009, tens of thousands of Montana kids had no health coverage. They had no way for their parents to pay for a doctor visit or a hospital stay. There were people, thousands of Montana families, who were one childhood medical emergency away from bankruptcy. People who prayed that their son or their daughter would not get sick. I traveled around the state. I met countless families who felt this way and who had this pressure and this stress. And I saw the pressure and the stress and the anxiety on their faces and the tears in their eyes as they talked about this problem. We had efforts every legislative session to try to increase eligibility in the Children's Health Insurance Program and in Medicaid for children. Many of those efforts were led by Mary Cafaro, who's going to share a few words with us today as well. Unfortunately, session after session, they met with defeat or ultimately very limited success. 2003 and 2005 sessions, there were bills, I think, to increase the eligibility of the Children's Health Insurance Program to 200% of the federal poverty level from 165%. It was about $30,000 a year for a family of four, combined household income to qualify for CHIP. Representative and Senator Cafaro tried, along with other people, to get that increased unsuccessfully in 2003, unsuccessfully in 2005. In 2007, the CHIP program eligibility was increased a little bit to 175% of the federal poverty level. But still, there was great resistance. By 2008, Montanans were really fed up with this situation because it was clear that a majority of Montanans supported broader coverage. And so a group of us got together and we wrote I-155. I-155 created a new storefront for Children's Health Insurance Program and Medicaid called Healthy Montana Kids. Come on in, you guys. This is all about you. And it put CHIP and Children's Medicaid behind that new storefront, Healthy Montana Kids. It increased the CHIP eligibility threshold to 250% of the federal poverty level and allowed Medicaid to be increased for children up to as much as 185%, creating a sliding scale to maximize the drawdown of federal funds. It eliminated the asset test for children enrollment in these programs. It created a simplified application process. And importantly, it created a new role for enrollment partners, hospitals and schools and individuals and organizations that could participate in help getting kids signed up. Because one of the problems there was eligible kids that didn't understand what was available to them and these new enrollment partners were there to do that. So all of this was done without a tax increase. There were existing tax revenue streams coming in through premium tax that were channeled into a special revenue account and drew down lots of federal funds and matching funds that were available to Montana but had been left on the table in the past. Montanans went to the polls in November of 2008, and they passed HMK, as Jenny said, by a margin of 70-30. She called it a good margin or a significant margin. I'll call it a landslide because I think that's what it was. But it didn't happen on accident. And I want to do some, I want to recognize some people that were instrumental in getting HMK on the ballot, in campaigning for its passage, and then ultimately people who implemented the program and made it a reality. First, I want, however, to recognize that we have some friends with us today from Jefferson School. This is the second grade class of Mrs. Hawkins, who is with us right here, and her assistant, Mrs. Carney. And they've done an excellent job shepherding this group of wonderful young people who happen to be wearing Healthy Montana Kids shirts from 2008. And they're going to take them home with them, and they can wear those as much as they like. I had the enjoyable privilege of watching them play on the playground today with these T-shirts on, and I have to tell you, it warmed my heart. Healthy Montana campaign folks. Our campaign advisor, Doug Mitchell, who's now with the Glacier National Park Foundation. America Dominic Heaton, who was field director for the program. Petition captains, Jamie Newman, Molly Bell, who's with Senator Tester's office now. Jen Hensley, who's here with us today. Bradley Seaman, who's in Missoula. Angie Buckley, Kim Abbott, who's a member of our legislature. All of these people were helping to drive the successful petition circulation that happened in 2008. And there were also lots of other individual group organizations that got involved, like Montana Women's Vote, who helped to collect signatures to make that possible. We had contributors that made a huge difference in 2008, and number one among them was the Children's Defense Fund and Christina Davis. Christina, would you raise your hand, please? The Children's Defense Fund put $25,000 into the campaign, and Christina worked as really a full-time staff person in helping to get I-155 passed. Blue Cross Blue Shield of Montana. We have John Doran with us today, a big supporter of HMK, and ultimately later the administrator that helped implement it and make it a reality at the implementation stage. The Montana Hospital Association, Montana Health Insurance Executive with Allegiance, Dirk Visser, personally contributed a lot. Wells Fargo Bank in Montana, Joy Ott stepped up. The SEIU, Service Employees International Union, Stockman's Bank, Glacier Bank. These are just a few of the very large contributors, but there were countless individuals who contributed smaller amounts who all helped to fund the campaign and make it possible. DPHHS folks, there are really too many to mention. I am very grateful that we have a couple of them here today. Mary Dalton, I want you to raise your hand, if you would, please. Mary was a tremendous leader of public health services and Medicaid for many years at DPHHS, and was really the captain of the implementation and the reforms that needed to be made after I-155 passed. Kathleen Buckley Patton, who I dealt with personally a lot back when the program began. Michael Mahoney is here. Michael, I know, has, Michael, where are you? Raise your hand, would you? I know Michael has done a lot to work with fielding customer service needs of the many people who still contact us about their own issues and dealing with Healthy Montana Kids and getting signed up and so forth. Thanks to all the current and former Office of Public Assistance staff at DPHHS who work directly with families to determine their eligibility. This work, of course, continues. Hundreds of external enrollment partners that partnered with DPHHS on outreach and enrollment after the program was launched. Advocates who testified at the state legislature for to open the trapdoor and let these funds out of the special revenue account and to preserve what the voters passed in 2008. As I said, Blue Cross Blue Shield of Montana for its administration work, and the many families who've been outspoken advocates about the importance of this program.